Hello everyone. Today we are learning about monoclonal gammopathy of undetermined significance, that is Mgus. Case definition. Monoclonal gammopathy of undetermined significance is an asymptomatic pre-neoplastic plasma cell disorder that is characterized by increased serum M protein. The level is usually less than 30 gram per liter. Bone marrow clonal plasma cells less than 10%. Absence of plasma cell myeloma related end organ damage such as hypercalcemia, renal insufficiency, anemia or bone lesions, and absence of B cell lymphoma or other diseases known to produce M protein. There are three distinct types of Mgus. First is non-IgM Mgus, that is Mgus related to IgG, IgA and IgD. They accounts for the majority of Mgus cases and is characterized by monoclonal plasma cell. Second is IgM Mgus and third is light chain Mgus. Non-IgM Mgus may progress to malignant plasma cell neoplasm. IgM Mgus may develop into Waldenstrom macroglobulinemia, immunoglobulin light chain amyloidosis or lymphoma. Light chain Mgus is characterized by monoclonal protein that lacks the immunoglobulin heavy chain component. LC Mgus may show progression to idiopathic Baines-Jones proteinuria, light chain plasma cell myeloma, AL amyloidosis or light chain deposition disease. Cause. No specific cause of non-IgM Mgus has been identified. However, the disease may be associated with some non-malignant disorders such as connective tissue diseases, peripheral neuropathies, dermatological diseases such as acquired C1 esterase inhibitor deficiency, endocrine disease and hepatitis C virus infection and HIV liver disease. The majority of non-IgM Mgus are IgG followed by IgA, biclonal and IgD. Diagnosis. CBC usually normal but may show rouleau formation. In the bone marrow biopsy, plasma cells are less than 10%. It can be identified with CD138 and monoclonality can be seen as either kappa or lambda restriction by IHC. M protein can be identified in the serum or in urine by electrophoresis or immunofixation. In the immunophenotype, monoclonal plasma cell with bright CD38 expression with aberrant CD56 population can be seen. Molecular. Usually normal karyotype is seen but translocation 1114, translocation 414, translocation 1416, deletion of 13q and hyperdiploid seen. In suspected high-risk non-IgM Mgus, the whole body CT to rule out multiple myeloma is recommended. If the whole body CT is positive, a PET CT should be done. Risk and assessment of progression. Three major risk factors for progression of Mgus are: first is abnormal serum FLC ratio. Second is non-IgG Mgus. And third is high serum M protein level more than 1.5 gram per dl. Based on Mayo Clinic stratification model, the presence of all three factors constitute high risk Mgus. High intermediate risk Mgus is present if only two of the factors are present. Low intermediate risk Mgus is present if only one of three factors is present. The absence of all three factors is classified as a low risk Mgus. This is the suggested algorithm for monitoring patients with Mgus. First, patient is confirmed with Mgus, then investigations required are CBC, serum M protein, create calcium assessment in 3 to 6 months. If signs of progression and red flags are absent, check for M spike. If it is less than 1.5 gram per dl, the immunoglobulin chain is IgG and normal FLC with no red flags, then no Mgus directed follow-up needed. If these all are absent, like M spike is more than 1.5 gram per dl, non-IgG Mgus, abnormal FLC and no red flags, then evaluation is needed every 6 to 12 months. And if the red flags are present, then evaluation for Mgus progression is needed. What are the red flags? Constitutional signs of malignancy including excessive fatigue, drenching, night sweat, fever, unintentional weight loss, excessive bone pain or pathological fracture, neuropathy, organomegaly and lymphadenopathy, mucocutaneous bleeding, unexplained anemia, elevated creatinine and renal impairment, unexplained hypercalcemia, progression of serum M protein more than or equal to 50% or more than equal to 3 gram per dl, progression of involved serum FLC by more than or equal to 50% or the ratio of involved to uninvolved FLC ratio is more than or equal to 100, urine protein electrophoresis showing urine M protein more than or equal to 500 mg in 24 hours. These all are red flags. Treatment. Treatment is usually not recommended for the patient with Mgus as there is a risk of progression to lymphoproliferative malignancy. Long-term follow-up is advised. If a patient has an IgM protein, bone marrow biopsy, CT scanning of the abdomen may be helpful in detecting Waldenstrom macroglobulinemia and other lymphoproliferative disorder. IgM, IgG or IgM-Gus may be associated with chronic inflammatory demyelinating neuropathy which responds to one of the typical CIDP treatment. So this is in short about Mgus and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.